Hello, everyone. Welcome to week 4 of CED 523 Treatment Planning and Evidence-Based Practice in Addiction Treatment, where today we'll take a little bit of a deeper dive into cognitive behavioral therapy. So, when we look at cognitive behavioral therapy, there are a number of different approaches that have come from this, including DBT next week. We also have REBT. There's a number of different approaches. But when we look at cognitive behavioral therapy, there are three major principles that are really scattered throughout all of these approaches. So the first is that behavior is influenced by cognitive activity or our thought process. The second is that our thought process or this cognitive activity can be observed and can be modified. It can be changed, right? The last being that our behaviors or our actions, like the change here, can be influenced by the changes in these thought processes. So CBT is often looked at as a short-term and goal-directed approach, right? And so our role is to work with clients to be able to learn, identify, monitor, and often modify and shift different cognitive distortions or adverse behaviors, right? Going back into some of our work around motivational interviewing, CBT is often most effective when we have a collaborative therapeutic relationship with clients. And again, our goal is to work with clients to reframe these thought processes and beliefs that lead to more positive outcomes. So here I'm sharing my screen to share with you one of the resources that is often used in cognitive behavioral therapy. So this is what's known as the cognitive triangle. And so first what we see is that there's a situation or there's an activating event that leads to certain thoughts. And these thoughts are often looked at as this is the interpretation of the situation or this activating event. And from these thoughts influence our emotions, which can be our feelings, different somatic sensations, and also influence our behaviors, the way that we respond to this situation. And so when we look at cognitive behavioral therapy, part of our role is to work with clients to identify these maladaptive thought patterns that stem from an activating event or a situation. Some of the language that you'll hear around cognitive behavioral therapy is this idea of a cognitive distortion. A cognitive distortion is an irrational thought that shapes how one sees the world, how we feel, how we act, how we behave, right? Many clients that struggle with addiction will present with these cognitive distortions. There are a number of different cognitive distortions that people may present with, such as catastrophizing, overgeneralization, all or nothing thinking. So take a look at the cognitive distortion resource for details on a number of different cognitive distortions that may present with the client in the clients that we work with. So looking at this model of the cognitive triangle, right? Another really integral piece to cognitive behavioral therapy is this idea or this concept of core beliefs. So core beliefs are one a person's most central ideas about themselves and about the world. Right? This is truly the lens that we see everything through. It'll impact our thoughts, it'll impact our feelings, it'll impact our behaviors. Right? And so when we're working with clients using cognitive behavioral therapy, part of our role is to help them identify some of these harmful core beliefs, right? And work with them to help reframe these harmful core beliefs into more helpful core beliefs. Take a look at the video of the ABC model of CBT, and this will walk through a process of identifying the activating event, the belief that one has about that themselves, how it leads to certain emotional or behavioral consequences. So when we look at addictive behaviors, oftentimes they're driven by a combination of these deeply ingrained core beliefs that one has about themselves and really situational specific thoughts or cognitions around whatever it is that might be happening at that time. To take a look at the first reading, which really breaks this down into two tiers, these proximal situational factors and distal background factors. This might be a really helpful way to conceptualize some of the challenges that clients have with addiction. When we look at these distal factors, right, these core beliefs or these basic beliefs we have about ourselves are shaped by a number of factors. They can include early life experiences, whether it be family upbringing, societal influences, culture, as well as just the environment that we're living in. It can be the people that we surround ourselves. It can be other different pieces around what shaped our life to this point. And so when we look at some of these basic beliefs, right, some of these core beliefs are often harmful, right? Examples would be I'm a bad person or I'm helpless, right? And so these core beliefs are often influencing and impacting someone's continued engagement in harmful addictive tendencies. Right? So when we look at addiction related beliefs, right, we break it down into these anticipatory beliefs as well as relief oriented beliefs, right? And so both these basic beliefs and these addiction related beliefs are activated by triggers or a situation, right, that start to cue this addictive behavior. Right? So triggers can be a number of different things. They can be intrapersonal, something coming from within. They can be interpersonal, right? So an interaction with a friend or a family member or a colleague, or it can be some environmental stimuli, right? All of these triggers lead to some of these proximal situational factors, right? That really start to influence challenges in breaking this addictive pattern and cycle. And so our role would be to work with these clients to uncover and identify, right, these harmful beliefs that lead to some of the situational factors that lead to addictive tendencies. So sharing my screen here is an exhibit from that first reading for week 4, where we have these distal processes, right? Different factors that have led to these basic beliefs and these addiction related beliefs, right? And so earlier we talked about the situation or the event, right? So here we have a trigger, and this trigger will also often lead to these addictive related beliefs, right? And once these beliefs are triggered, right, oftentimes we have this autonomic thought process, right, around our addictive behavior, right? I'm not a good person, and oftentimes wanting to engage in a thought that leads to this addictive behavior, right? This automatic thought will lead to cravings and urges to want to use substances, whether that using that substances to reduce the emotional impact or the weight of this harmful belief or another strategy or mechanism, right? And so oftentimes we'll have this craving or urge, and this is often called cue recognition, right? So being aware of the trigger that led to the craving or the urge to engage in addictive behavior. Oftentimes clients will, right, start to rationalize and focus on beliefs to give themselves permission to continue to engage in this problematic behavior. And then having beliefs on, you know what, let me do this, let me take this step, let me use alcohol, let me use other substances, let me engage in a harmful addictive behavior, right, to ultimately mitigate or reduce the impact of that trigger, right? And so this is a really important process to be aware of. And while we might be working with clients on recognizing these cognitive distortions that come up here in the moment, right? We're also too wanting to work in adjunct with identifying and recognizing these core beliefs, right? And how do we reframe some of these core beliefs to influence the addictive tendencies or patterns that come up when a situation arises or one is triggered to have these urges and cravings to engage in substance use or other addictive tendencies. A few other points to bring up around cognitive behavioral therapy is oftentimes the length of treatment can vary greatly. CBT can be brought in for a single session. It can be implemented or integrated throughout a 12 session period or a 16 session period. And another piece around CBT that is not necessarily specific to CBT, but that is really often found within this process is the emphasis on homework, right? Or practice outside of sessions, right? And so this practice outside of sessions will help clients to start to identify these harmful core beliefs. We'll start to notice the unhelpful cognitive distortions, whether it be catastrophizing or magnification, to start to be more aware of these adverse thoughts or these adverse beliefs that are impacting addictive tendencies. So, as talked about with motivational interviewing, right, CBT can be combined with different empirically supported strategies, whether it be MI, whether it be contingency management, right? And oftentimes the combination of these evidence-based practices can really bolster, right, early treatment engagement and adherence to, right, the treatment that you might be engaging with clients. Right. And so this is just a brief snapshot of CBT. There is a ton of resources and material for you to review this week, and we have 5 videos. Pay specific attention to the ABC model, and this can be a really helpful tool or framework to engage with clients as you're integrating CBT into your practice. There's a number of different resources, whether it be the cognitive triangle, information around cognitive distortions or core beliefs, as well as a number of readings for this week. So lastly, there'll be 3 assignments. All are due at the end of the week, except for the discussion board post. And so please ensure you complete the discussion board post early enough in the week to allow your peers to have time to respond to your initial post. So we'll have the discussion board post. We'll have a reflection on the proximal factors that we talked through a little bit here today, as well as an assignment on conceptualizing a case through a CBT lens. So I hope you all have a great week. As always, please reach out if you have any questions. And I look forward to reviewing some of your work and diving into content for week 5, which is around dialectical behavior therapy and harm reduction approaches. So take care and have a great rest of your week.